As a regenerative medicine physician, one of the most common questions we get asked is, what would you do in my case? So I'm going to show you today. I've been having a little bit of pain in my right knee that started after a ski injury that occurred about 4 years ago. And I'm starting to have a little bit of pain that's impacting my function. Now, day to day, I'm relatively pain-free, but I noticed that if I'm running greater than 3 miles, I'm starting to have a little bit of soreness afterwards. I'm not doing those 5-mile runs like I want to, so it's starting to impact my activity level, and so it's time to have treatment and get back to 100% functionality. Core to every regenerative medicine procedure is a blood draw. One of our very skilled and talented nurses will draw your blood. It's almost painless. The amount of blood drawn depends on what we're treating, how many areas that we're treating. And after the blood is drawn, it's going to go to our regenerative medicine laboratory where it's processed. In my case, I'm going to be treating my right knee. And research shows that I would like 10 billion platelets to have the maximum dose. So I'm going to draw enough blood to get to that 10 billion platelet threshold. We'll talk a little bit more about how that's measured later. So I'm here in the laboratory. Now that Braden has finished processing my platelet-rich plasma, he's going to run it through the hematology analyzer so we know how many cells we got. So now that the results are run, we have measurements of both my baseline blood, platelet count, and the platelets in the platelet-rich plasma. So now that my platelets have been processed into a super concentrated platelet-rich plasma, it's time for the injection. Now today, Dr. Nemery is going to be doing my injection. So I'm here in the procedure suite. We're always using imaging guidance for this injection, ultrasound and fluoroscopy. Dr. Nemery's chosen to use fluoroscopy for today's appointment. This is a relatively painless procedure. My blood was drawn and concentrated down to a dose of 10 billion platelets, which research shows is needed to have the maximum effect, so I can get back to my prior level of function, avoiding NSAIDs, steroids, and surgery. For more information about us, visit us at www.nwc4rm.com.